Hello, doctor.
Hi.
Doctor, when I first heard about you, I went through your Google reviews and I was shocked to see the gratitude of your patients towards you. Most of the patients were having life-threatening diseases like brain tumors, heart diseases, and cancers. But in between, I saw a negative review. But still, a patient of yours, she was having coronary artery disease. And she is claiming to say that you don't treat coronary artery disease, only heart failures, and you need proper investigations. So, can you please explain?
Usually I treat for the heart failure cases related, if we talk about the heart related diseases. Coronary artery disease, normally she was above 65. The person who is above 60, always there will be atherosclerosis. That means aging of blood vessels. In the aging of blood vessels, if the doctor is claiming that there is blockage, that is permanent. The patients with below 60 years, most of the patients will be with triglycerides may be increased or LDL may be increased. That may be blocking their coronary artery. That by just controlling their food along with the allopathy high dose medication, after reducing it, if they go for the normal life routine exercises and all, it will go on its own. It will go off. But above 65 or 60-year-old persons, this is like a cement-like. We cannot give the medicine and remove that. But we can do one thing. We can make collaterals for the patients. How bypass is doing. The block will be there. They give another way. The same way small blood vessels come by the treatment and get rid of from that. But normally I treat for the heart failure patients. If already there is other option for a patient to get rid of from the problem, they can do the angioplasty or bypass. I am not against for all that. The patient could live more than 5 years and 10 years by doing that. Let them do. But I am against for the patients who is below 60 and doing the angioplasty and bypass surgery. If we are in emergency, if the patient aged 40 years is facing the emergency, that time we have to do the proper investigation and proper treatment like they suggest for the bypass surgery and angioplasty. For that I am against. For that time we can do only balloon plasty because the blockage, there is no need of extra support of stenting. Because if the cholesterol is going down, the blockage will go off. But in heart failure cases, I treat for the heart failure cases as she mentioned. That's why I told her I won't take the case because it's coronary artery disease. Just she have high BP and high cholesterol. If she take the medicine, she will be okay. Why should she come here for the? She called me from London. Then I told her here the practice is for only for the heart failure patient. Why I said so is there is lot of cases come to me is with suggested for heart transplantation, ICD implantation, all that. That time the patient won't be having that much availability of heart and the money also is the problem. So more than that, we cannot treat, there is not even single doctor who can claim that okay, I'll make the heart okay in the echo and ECG. But I could able to do that in most, not all the patients, but lot of patients I could able to help them. I treat for heart failure due to ischemic heart diseases, like she told, coronary artery disease. After coming coronary artery disease, if the patient is not getting enough blood supply and he's doing excessive works and all, he may get the heart attack. That time heart function comes down. Then there is patients with dilated cardiomyopathy. Dilated heart become very big and the conduction system will be collapsed. That from the childhood itself the disease will be there, but we find out at 18, like depend on the patients and they, like age, like some patients we get at 3 age, some patients we get the time of birth itself and the doctors say that. Then another patients after 40, 30 years and all. Then there is patients with quantum cardiomyopathy. The after birth of a kid, the mother get the heart dilation and heart failure. That is dilated cardiomyopathy. Then the patients with PAH, pulmonary arterial hypertension. That is there we had to transplant both lungs and heart together. That and all is not practical. Most of the patients come to me will be not only pulmonary arterial hypertension, with the complication, that means right heart failure. Along with the right heart failure, there will be right heart in the sense right ventricular failure and the left ventricular failure. That means biventricular failure. In such cases, nobody is there to take care of them, at least to maintain them. Then the patients with HOCM and HCM. HOCM is hypertrophic obstructive cardiomyopathy. There, the blood is not able to reach to the all part of the body, because in aorta the VS is little bit bulged. It will be blocked. The pressure will be more. The gradient will be high. So there is a chance of blackouts and stroke, all that. Such patients, only ablation is remaining. That and all is not a permanent solution. And another thing, they can do ICD and heart transplantation. Then HCM patients also asymmetrical thickening of IVS. All these cases are there. Then there is no other doctor to save them, or I have the ability to do that. Why should I go for a patient who is not in a disease? She is already aged. Because of that, she got that disease. All other patients, not because of their age, then they are not able to sleep at night, full swelling, not able to take food, all that. We should take care of them, right? We have to think about their life. If there is another chance, for another way for a patient to get rid of from one problem, then we should not take that cases. No, that's why I was telling no to them. Then we should be truthful for the patient. If I am not able to remove the block, how will I say I'll treat for the coronary artery disease? I can make collaterals only. For that, they themselves can do that and all. There is no need of even treatment itself. So I told that. Another thing, I am treating such deadly diseases. As I told you, you understood that, no? When we do that, I'll be very specific for the patient to take latest echo and ECG, and after the treatment also. It's not like 4 year, 3 year back you took the echo, or 3 month, 4 month back you took the echo. I need very latest reports. Only then I take the case itself.